Now that you're pregnant, exciting times ahead. Also, there can be some nervousness, so definitely go check in with your healthcare provider, or you can visit us at www.athenawomensclinic.com.au. I'm Dr. Kavipriya Soma. I'm here to just provide general advice. If there's anything specific, please talk to your own healthcare provider. So, what happens in your first visit when you find out that you're pregnant? First things first, the urine pregnancy test that you do is reasonably reliable. So we don't have to generally repeat the test unless you have a concern or you want us to confirm it for you. So definitely we can repeat that test for you. Some doctors may have an instant blood test that is available. Otherwise, there is a blood test that we use to confirm or follow up in special cases or at the discrimination of your own healthcare provider, depending on the conditions that you're presenting to us with. So just an overview of what happens in the first trimester of pregnancy. So what do we call the first trimester? So it's the first 12 weeks of pregnancy is called the first trimester. What can happen? Some of the physiological symptoms that you may face is nausea, vomiting, very common. Just because you don't have nausea or vomiting does not discount you from being pregnant. So please be assured of that as well. Not all women experience all these symptoms. So nausea, vomiting, some temporary abdominal cramps, or increased frequency of going to the toilet, they're all the common symptoms that you may experience. The other common symptom that you may experience is tiredness. Most women figure out or come to us and say, I'm extremely tired. And that could be one of the ways you actually figure out that you're pregnant. And you're tired, you go back, you think, oh, when was the last period I had? And then you do a pregnancy test, you figure out you're actually pregnant. So that's generally how you detect or you find out that you're pregnant. Some women can also experience some breast tenderness. So when you visit your healthcare professional, what are the things that we generally go through? This is again a general guide only. Please talk to your own healthcare professional. The advice may differ depending on your own circumstances. In the initial consultation, we talk about your general health. We talk about your medical and surgical history. We also talk about your previous obstetric history. These are the things that will guide us as to how we provide the care for you in this pregnancy. We also organize some basic bloods as discussed in the preconception care. So similar to that, we organize the basic bloods, which includes your iron, your vitamin level check, your infection screen, and your blood group. We also organize a dating scan. I know this is not compulsory, but it's available to us to confirm the dates, especially for women who have had irregular cycles or medical history or unsure of the last period, or if they've fallen pregnant closer to the birth of the previous child where we don't know the date of the last period. It is generally recommended you get a dating scan done, because the due date will be determined by this dating scan and all the ongoing care will be based on that due date, and assessment of fetal growth will be on that particular due date. So it's really important that you have this particular scanning done. Also, it helps us determine when you can get the first trimester screening for Down syndrome done too. So this is usually what happens in terms of what the doctor can offer you or the healthcare professional can offer you. Please be advised you can also see the endorsed midwife for your care during this time. Now, the general advice again would be to eat healthy, so whole meal foods, fruits, vegetables. Sometimes you may struggle with morning sickness or nausea and vomiting in pregnancy, so you might have to tweak your diet accordingly. Again, keep your diet simple. Plenty of fluids. If you're not able to tolerate fluids, ice chips, icy poles are a good option. Sometimes if you are struggling with severe morning sickness, you may end up in the hospital or you may have to have some IV fluids to correct them. There are medications that are available in case you need to manage those symptoms. Please speak to your own healthcare provider, or you can visit us at athenawomensclinic.com.au and book an appointment and we can walk you through the process as well. Now, once you've had this dating scan, then you will have the follow-up appointment booked with your doctor or healthcare provider, and then the subsequent discussion of Down syndrome screening will be discussed with you. So the ongoing care in your first trimester. So after you've had the set of bloods and the dating scan done, you're going back to see your own healthcare provider. Then what do we do? So the important things is that are checked are your iron levels, your vitamin levels, making sure that they're all appropriate. We also check and make sure you're not a negative blood group. And the dating scan, as said before, will confirm the due date. Now, based on that, we discuss the first trimester screening. So what is first trimester screening? I'm sure most of you all have heard about Down syndrome. So all of us are coded by 23 pairs of chromosomes or 46 chromosomes. So what happens? Sometimes the embryo is made of 47 chromosomes instead of 46 chromosomes. Now, having extra is not nice sometimes, and that's what happens in babies. So having that extra genetic material can cause potential detrimental effects to baby. So that's why this is available. This is an optional testing that is available to you between 10 to 12 or 14 weeks, depending on the test that you prefer to choose to have. This is not compulsory in Australia, but it is available to you. So I would leave it with you to discuss with your own healthcare provider to choose what's most appropriate for you. The first option you have is the combined bloods and the ultrasound, which gives us the risk estimate of this pregnancy being at risk for Down syndrome and trisomy 13, 18 and sex chromosome aneuploidies as well. So this is a combination. So you have the bloods done, you have the ultrasound done, and then both are combined into an algorithm, and then we get the final result as a high or a low risk. If it is a low risk, we're quite happy to keep going further. If it is high risk, you have the option of confirming what is happening in this pregnancy. It doesn't mean your baby has been affected. It is only a screening test. Remember that, please. The second option you have is the NIPT or the Harmony testing. All labs are offering this at the moment. This is also done after 10 weeks, wherein we try to isolate baby's chromosomes from your own blood, and we look for the extra pair of chromosomes, if any. Again, the detection rate goes up significantly because the baby's chromosomes are being isolated. This also detects for trisomy 13, 18, 21 and sex chromosome aneuploidies. You do have the option of having an extended panel done in this, but I would encourage you to speak about that with your own healthcare provider to see if that is something that is suitable for you, because sometimes you can end up having false positive tests which can give you unnecessary grief as well. So please speak to your own healthcare provider or visit us at www.athenawomensclinic.com.au to book an appointment and discuss about this further. So this is all the content that you've just listened to for the first trimester. We will be releasing subsequent videos for second and third trimester if you'd like to have a look as well. Go on to athenawomensclinic.com.au website or our YouTube channel and have a little listen. Good luck with your pregnancy.